Hi, I'm Chris Soule, infectious disease physician at Wake Forest Baptist Health and advisor for COVID to Wake Forest University. I've been asked to comment on some of the small increases in cases that we've seen on campus at Wake Forest University over the last 2 weeks. You might be surprised to know that I'm actually not concerned about the number of cases that we've had over the last 2 weeks. In fact, they're well within the expected range that I would have predicted when campus first opened about 3 weeks ago. The numbers have been small and the increases have been extremely well managed by the university through contact tracing, isolation, and quarantine. So the question then comes up, what would cause you to be concerned and lead you to advise Wake Forest University to change the way we're doing things on and off campus, to change the way we learn and how we interact and live? Well, it's not just one thing. It's just not just the numbers of cases, but it's a lot of other metrics we look at. We look at our surveillance testing that we do weekly, and we look at the percent positive in those tests. Over the last 2 to 3 weeks, those numbers have actually been very small, less than 1%. We would look at the percent positives in people who present with symptoms of respiratory illness or flu-like illness. We would look at where the cases are occurring, and then we would take measures to contain it within those areas rather than impacting the entire university. We would also look at the number of cases and percent positives for tests in our community. And is our community impacting on the university, or are our small numbers of cases on the university impacting on the community? So far, we haven't seen that. Our contact tracing is going very well. Isolation and quarantine has been very quick and very robust. And we have contained the small number of infections that we've seen. So what can you, as students, as the primary stakeholders in keeping COVID at bay, do? I think probably the most important thing is wear the mask, particularly when you're indoors and around other people. If you're outdoors and within 6 feet or can't distance, you should be wearing your mask then also. We need to continue to keep the numbers at our gatherings small. During these times with these gatherings, you need to continue to be distanced and use your mask. If you're eating, then you really need to pay attention to your personal distancing and keep the 6 feet. So the original question, what's the magic number? There is no magic number that would cause us to change things on campus. It really comes down to, is there control? Do we know how to continue to keep the cases low and mitigated? Go Deacs.